Hi, I'm Alex Howard, and I'm here with Sarah Marshall from the psychology team at the Optimum Health Clinic. And today we're doing a video in our series around real-life cases of patients we've treated, really just to give a bit of an idea of the different ways that we work with patients, and really also a bit of an insight into some of the decisions we make about which treatments to use at different points. So I know, Sarah, you've got a patient today that you started off with a referral from the nutrition team at the clinic.
Yeah, so this patient came wanting just to do nutrition, and she started the nutrition protocol and was doing well, but her nutritional practitioner noticed that there was a lot of maladaptive stress response going on, and she was also aware of a lot of emotional events led up to the patient getting ill. So she was referred over to psychology, because obviously we work in an integral approach, and we started to look at her kind of background and her helper type, her type, which was a helper type, and also what stage she was in.
Well, I think, maybe we should talk a little bit about the helper. Obviously, we've done lots of other videos and that about it, but maybe I think it's good to give an example of what the helper type meant for her in her situation, so how that was manifesting itself in her life.
Yeah, sure. So the helper type obviously is very much about helping others, which can be a really good thing. It's nice to be caring, it's nice to want to look after other people and help, but there comes a point where it becomes destructive, or it has a negative impact on ourselves. It's very much about having family members that need a lot of help from us, and we're constantly putting them first to the detriment of our own help. There might be a lot of situations going on in our lives with friends and family that we feel that we need to kind of fix, or it always comes to us about helping out and kind of making sure everything's okay, whether that's needed or not. It's very much a role that we can end up in, and obviously if we're in that role, then other people see us in that role, and it becomes kind of not quite sure how to explain.
We create a rod for our own back.
Well, yeah.
Part of what happens.
Yes, basically.
Yeah, and I know that one of the ways that we also describe it's like we call them energy depleting psychologies, and it's like it's a way of being in the world where, for example, this patient, it may well be that her body was saying, I'm tired, and then her mind or the environment would say, but I need to go and help this person. Yeah. And that would happen again and again and again. So the body would be giving signals or eventually symptoms that it needs to rest, just in normal everyday life. But there's constantly a demand being placed upon it to take care of everybody else first. Yeah,
so we very much look at, there was a lot of emotional tiredness going on, obviously because she was emotionally tired from kind of that energy depleting behaviour. We also look at kind of the drivers behind it, and why we feel we must keep helping, looking at kind of the fears, what we feel that might happen, whether that's kind of based on reality or not. So that's kind of where we started, although we did start with calming the system down as well with a maladaptive stress response. And a lot of the time I work on kind of stabilising from that area only, but with this patient we very much needed to start to work on the emotional stuff at the same time, because that was the thing that was driving a lot of the stress response of, I need to help, I need to keep going even though my body's telling me otherwise.
Well, I think that's one of the things that's often really important from a practitioner point of view, is working out which bits of treatment are going to be effective at which point, because for some people they really need to calm down their nervous system to be able to do the emotional work. And for other people it's all of the emotional stuff that's going on which is driving up the nervous system, and actually it needs to be worked with to support it and calming down.
So by working with the two in conjunction, on the emotional side we only worked on what was going on now. We didn't, I know a lot with EFT, we were looking at the kind of the core issues, the root causes, but at this stage what we needed to do was just work on the surface stuff to begin with, to help her to start to calm down. Yeah,
part of the way I think about it is you've got to have a stable foundation before you start digging.
Exactly.
Because if you start digging without a stable foundation, then you just end up going all over the place.
And it can be very overwhelming, especially when we're working on the emotional side. So we want to have a really good stable baseline, and even if that baseline isn't completely calm, what we're looking for is calm enough, as you said, to start digging. And also in that period we want the patient to be very comfortable with using the tools, starting to get confidence in the tools themselves, them using the tools before we then start digging, because digging can bring up other emotions. And if that happens in between sessions, we want to ensure that the patient is able to manage that, or at least be able to ask us and we can bring sessions forward if needed.
Yeah, because of course if someone's got a really strong helper pattern, their tendency will be, if they're in an emotional crisis, to ignore it because they've learned to reject their own needs. So it's getting the patient to the point they can recognise when they need help, but also to be able to give themselves what they need rather than contemplating everyone else's needs first.
And the other thing that plays out is that if we haven't worked enough with the helper type at that point, is they feel they have to do it all themselves, so they can't reach out and ask for, I need to bring my session forward, or I need an extra session. So that is very much part of the work as well.
Yeah, okay, good. So what was the next stage after that?
Once we worked through the surface emotional stuff that was going on and the maladaptive stress response, we found that her energy started to come back pretty quickly. I mean, she'd already been working on the adrenal side, on the nutrition and the energy production, so her body started to respond very quickly. But what we needed to look at was very much her helper type, that she wasn't then using this energy that was coming up to helping others and pushing herself in that way again.
I think this is one of the most interesting things that kind of from my perspective that we see, that it's almost like as soon as we get the energy back, the tendency is to go back to all the things that caused us to get sick in the first place. It's almost like when we're ill, we just can't do those things. So if someone's a helper, they have no choice but to say, I can't come and help today because I can't get out of bed. But then the energy starts to come back, and that's often the point where you really get the opportunity to work with the deeper underlying patterns. Talk about going digging, you need to dig sometimes to get the roots out, but you've got to get the stable foundation first. But as the energy starts to come back, that's the point we really have to start looking at. Now they've got energy, where are they spending it? And there's a real tendency, if there's a helper pattern there, to go off and do a load more helping, which then informs the next stage of work that we do.
So what we did, we looked very much at, helping her to stop those tendencies, and when you start to stop those tendencies, then a lot of the emotions come up about, well, I'm going to feel very guilty because I've got this energy and I'm not helping them. And we also start to look, as you said, dig to the core roots of why do we feel we need to help people even when we can't physically help them, what's going on there. So we started to look at core issues, the impact of her starting to stop these patterns, and also how to establish new ones. So how can I help more effectively? How can I say no and be okay around that? How can I trust other people to kind of help themselves with me having to get involved all of the time?
It can be really a whole new way of being in the world. It's like our whole self-image, our whole way of relating to others is defined by our personality characteristics. And if they've caused us to get sick, and then we couldn't do them because we were sick when we start to get well, that's often one of the most important places of people really doing the work to not just feel better, but to get lasting recovery. And I think that's where, if people don't work on these patterns, if they're a key component, which obviously in this case it has been, that if people don't work on these patterns, they can take, for example, supplements to give them more energy, or they can do certain psychology things that will give them more energy, but the energy just goes back into the old pattern, they're going to keep crashing. And that's where I think there's a group of people that come to the clinic where they're better than they were, they've even stabilised themselves, but they keep on getting better and then crashing. And that's until they deal with the underlying patterns that will tend to keep on happening.
And this was very important in this case in the reintegration, because it wasn't going to be sustainable recovery if we didn't carry on with this work. So we did look at, we worked with a lot of the core issues, which helped collapse some of the behaviours anyway, because a lot of them were driven by kind of guilt, or this is what I need to do. But it is about looking at being different. How, if I take away all of those old behaviours, then what am I left with? And if we don't know how to behave in a different way, then we're going to go back to the old way, and again we get sucked back into that, and we start pushing, as you said, and that's why people can recover very well and then crash again, because they haven't done this last very important stage.
And the ironic thing, of course, is that once we have a lasting sustainable recovery, if we want to help people, we can do it in a way which we can sustain, rather than do it for a while, perhaps overcommit ourselves and then not be able to follow through with it.
So we very much looked at kind of healthy boundaries. Can I really help this person or not? Or is this the best way to help them? Because a lot of the time, if we have a healthy type, we think we need to fix everything. When actually really helping is stepping back, listening, providing some support so that person can do it for themselves, which is very different for a helper type because we're so used to kind of, I'll do it for everyone else. So it was very interesting work, and she found it very interesting, and it did help her to kind of stabilise her recovery rather than going into that kind of boom and bust.
Well, I think, you know, it's that old phrase, you give a man a fish for a day, you feed him for a day, you teach him how to fish, you feed him for a lifetime.
Exactly.
And that's often sometimes the difficult thing can be if someone's got a helper tendency, they kind of, part of them wants to be in there helping all the time to be able to feel better about themselves. And when that's really worked through, it's deeply liberating for people, but it's much more helpful to the people around them because they become less dependent, therefore they can really support themselves.
Yeah.
So great. Well, thank you, Sarah.
Thank you.
And thank you for watching. And if you found this interesting and you're not a patient in the clinic, then it's really worth getting a free information pack and also having a free 15-minute chat where you can speak to one of the team, for example, Sarah, about your situation and see how maybe we can help you in your recovery. So thanks for watching.